In this video, we talk about the benefits of interval fasting in relation to type 1 diabetes. As discussed in the previous video, depending on the degree of damage, the pancreas here produces too little to no insulin that lowers blood sugar. Due to the lack of insulin, the blood glucose level is chronically elevated. Patients then have to resort to the familiar insulin injections. And here we come to a special feature: as soon as you eat, insulin is released. It is interesting to know that if the patient does not eat, which means that insulin does not have to be released, but he still injects himself with insulin, the result is a low blood glucose level, called hypoglycemia. Accordingly, it is advisable to reduce the amount of externally supplied insulin, the amount should, then by a qualified physician. A high insulin level, as well as a too high blood sugar level, damages the body. Especially the brain, the eyes, the nerves, and the heart are affected negatively. Now the question is it advisable for the diabetes type 1 patient to fast? Here it is important to know that the amount of insulin corresponds to the amount of carbohydrates. When these are eaten, glucose is released, which must be lowered again by insulin. Why? Because high amounts of glucose are dangerous for the body, especially for your arteries. But what happens to the glucose when we fight it with insulin? The insulin takes the excess glucose and stores it in different places of your body, for example in your liver, or it is simply converted into fat. The abdominal area is a popular place there. However, there is always a certain level of glucose in your blood because it is produced in the liver, made from fat and proteins. So the right level of insulin is needed here. Many patients suffer from double diabetes, consisting of type 1 diabetes and insulin resistance. On the one hand, no insulin is produced organically here, and on the other hand, the body cells are resistant to the artificially administered insulin. Intermittent fasting therefore has a major positive influence on existing insulin resistance, as it makes the body's cells sensitive to insulin again and able to absorb it. When fasting, you should also pay attention to the supply of B vitamins, electrolytes, minerals and trace elements, as well as vitamin C and vitamin E. What are the typical signs and symptoms of insulin resistance? Let's find out together in the next episodes. Thank you for tuning in.